Manhas, based in Pathankot. I'm basically a chest specialist of 25 years standing in the practice post PG. Our today's discussion will be on understanding hypertension generally. So, any blood pressure above 140/90 is called anybody having blood pressure above 140 above by 90 is generally labeled as hypertensive, and normal blood pressure in people is around 120/80. And people tend to develop hypertension as they age, they get older, they tend to develop hypertension. Family history also plays a role in the development of hypertension. Excess salt intake leads to hypertension. Not eating enough food with potassium can increase blood pressure and risk of stroke and chronic kidney disease. Eating processed and junk food also predisposes some people to the risk of high blood pressure. And then stress, obesity, smoking, alcohol intake, they all contribute to the risk factors. Lack of exercise, low mobility, and sedentary lifestyle, they aggravate the hypertension. Otherwise, there can be some medical conditions which by themselves predispose a person to hypertension, like hyperthyroidism, pheochromocytoma, things like that. So main, plan for managing hypertension in anybody should be, first of all, is prevention. And once we have diagnosed the case, then prevent the further aggravation of disease. And finally, to give the medicine and check the adherence to the medicine on a regular basis. So in prevention part, I would suggest people should exercise, eat in moderation, not take to alcohol, smoking, junk food, and food with preservatives, and check on their weight and stay active. And finally, they should have their periodic checkups with the doctors. Their blood pressure should be monitored by themselves or by the physicians they are attending on. And once they are diagnosed to be having hypertension, they should take the medicine as prescribed by their doctor on regular basis. Once the medicine is prescribed, its dose has to be titrated by the doctor, and it generally varies with the season. In summers, the dose of antihypertensive treatment required is generally less as compared to severe winters. And patients should be compliant to the treatment prescribed. They should not leave it midway, change it midway, change the brands on their own. They shouldn't do that. And hypertension generally coexists with obesity, with CAD, coronary artery disease, with CKD. All these have to be looked for aggressively. Dyslipidemias are also associated with hypertension. So hypertension is one of the disorders which comes clubbed with many other problems. So all holistic management should be taken care of. But for the patient's point of view, I would recommend they should have regular exercise. They should have healthy diet with number of fruits and vegetables and less preserved food, less oily food. And they should quit smoking if they are smoking, and they should not pick up smoking if they are not smoking. They should reduce or abstain from alcohol intake. And they should have regular blood pressure monitoring at their own level when they are domiciliary fashion in their own home by their own sphygmomanometers. They can be taught, and they must periodically visit the healthcare worker, provider, or the doctor regularly. And finally, stress management is very important. Take it easy. Work limited, and sleep on time, sleep good number of hours. Have good number of fruits in the diet, and stay kind of less busy and stressed. Ease out, live an easy life. Try to live an easy life. Be easy on yourself. Be kind to yourself. That's what I would say. And finally, adherence to medicine is very, very important. Consult your good doctors and take the medicines prescribed by them on regular basis, and don't change these medicine. Don't buy cheaper brands. Go good brands and take your medicines regularly. And finally, with the blood pressure, keep monitoring your sugar levels, your risk for kidney disease. It should be monitored. Eye checkups should be regularly taken up, and reduce salt intake in diet, and have potassium-rich fruits like bananas and lemons. They are rich in potassium. You can have that. And as far as dairy products are concerned, low-fat dairy products should be used. On 17th of May, we generally celebrate World Hypertension Day. This is a day dedicated to highlighting the importance of monitoring blood pressure and bringing global awareness to 1 billion people living with high blood pressure worldwide. The theme of this year's World Hypertension Day is measure your blood pressure, control it, live longer. It's very important. Ensure that your blood pressure is measured and control it if it is elevated on a regular basis. Women tend to have increased incidence of hypertension after the menopause. And losing a few pounds of few kgs of weight, being regular on exercise, stopping smoking, taking your drugs regularly will go a long way in preventing the aggravation of hypertension and its related complications. Always stay in touch with your doctors wherever you are living. Stay in close contact with them. Thank you very much.